On me. Okay, I'm going to exit out of it really quick. There we go. Are you able to see that again?
Looks good.
Okay. All right, we will get started here in one more minute. Did I post that to everybody?
I don't know.
Okay.
Oh, panelists and attendees. So right now, no, I think I think I did.
Okay.
Just to the panel.
Okay. All right, it looks like we have quite a few people here, so I'm going to go ahead and get started. First of all, welcome to our webinar about the introduction to ABA and Occupational Therapy. My name is Kelsey Helsper, and I'm a BCBA, so I will be talking to you about the ABA portion of the webinar.
And my name is Maeve London. I'm an occupational therapist, and I'll be giving you an overview of what OT looks like in the pediatric realm.
Awesome. So our mission here tonight is to provide support to you, your child, and your whole family. And that's our goal at all times. This process is really about making daily life easier for you, your child, and anyone involved in your child's life. So we're going to use behavior analytic research and science to guide our decisions on what to teach and how to teach it. So while this is important, it can also be intimidating to understand, and that's why we're here to break it down for you. And then another one of our missions is to always collaborate and make your experience meaningful. So we want this information to be helpful and useful to you, and we also want your input and feedback throughout the process. So please never hesitate to reach out to anyone on your team for more help. The objectives of our training tonight are to define reinforcement and how it is used to change behavior, to understand why behavior happens and not just what it looks like, to understand occupational therapy's role in pediatrics, and to understand how OT and ABA collaborate at Bierman. So during the webinar, everyone will be muted besides Maeve and myself. So this will be an active participation webinar in which we will be pausing throughout the presentation to ask questions. And we will do that using the chat feature that you can find at the bottom of this screen. The chat we found is the easiest and most efficient way to communicate throughout the webinar. And you can access it, like I said, at the bottom of your screen. If you can't find that, there are some other different features that you can use, like the raise hand or the Q&A, if you're having trouble using the chat. But for the chat feature, you can send your answers directly to us or to all the panelists. So there is a way to, whenever you are in the chat, select just to Maeve and myself, or you can select to everyone. And either way, we will refrain from saying any names when we get chats, and we'll not use any of your children's names as well. But if you do chat to panelists and attendees, everyone will be able to see your responses. And if you just chat to the panelists, then just Maeve and I will be able to see them. So we want to start first by taking a poll. So I'm going to launch the poll and you should be seeing it now. But if you don't mind to just take a second to answer this question. Okay. It looks like almost everybody was able to answer the poll, so I'm going to end the poll now. Let's see if it's gonna work. There we go. And okay, so the results here, most of you are new to ABA, so welcome. We're glad to have you here and glad to provide you with this information. And there are some of you who have had some experience or a decent amount of experience. So we're glad to have all of you here to share this information. So we are going to open it up to another poll as well. Bear with me, I'm having a little bit of technical difficulties here. Let's see. Okay. So now we're going to open it up to a poll. Sorry, Maeve, you go ahead.
So same general concept, just looking to see how much OT experience you guys have had. So no previous experience, less than 3 months, 3 months to a year, and more than 1 year of experience.
All right, I'm going to go ahead and end the poll. It looks like most of you have answered. And so it looks like, sorry, go ahead, Maeve.
No, looks like we have kind of a nice variety here. So some of you do have OT experience, which is great. So this should sound somewhat familiar to you. We also have some people who have not had OT experience before. So I'm very excited to kind of open up the OT world for you and let you know what we focus our therapy on. So either way, it's a great opportunity to kind of see what OT looks like at Bierman for everyone. All right, so I think we're going to start off tonight by talking about occupational therapy. It is very commonly referred to as OT, so I will probably continue to call it OT as we go through. So it's also, we call ourselves OTs, so I might say OT as a practice and OT as a person are quite common. So I'm going to click out of that and we can crack on. So what I like to do when I'm talking about occupational therapy is start with that word occupation, because there's a very common understanding of what that word is, and that's what you do for a living. And OTs certainly do work with people who need some support in their occupation in what they do for a living. But for us, it is literally any occupation that that you do in your day, is any activity that occupies your time. So from the time you wake up and get out of bed in the morning to when you go to sleep at night. So OTs also even work in sleep. So we're literally there for you 24/7. OT is over 100 years old. It was evolved from World War I when it was found that soldiers who had something to occupy their times while they were recovering had better recovery outcomes than soldiers who were just laying in bed and recovering. So we really made that connection between doing and health. And also that really clear connection between when you see the relationship between what your therapy is targeting to what you're going to be able to do in your life, you have that intrinsic motivation to participate in your therapy. So it's kind of that carrot and the stick. So when a diagnosis or a disease or an injury kind of prevents you from engaging in your daily occupations, your daily activities, OTs are there to help. We use anatomy, physiology, and neuroscience to assess function, and then we design interventions to increase independence in your activities. So for example, if you broke your hand and you really would like to be able to get back to dressing yourself independently again, OTs will help with that. So OTs work everywhere, every disease, every population. They work in schools, prisons, acute wards, clinics. So it's really an intervention style that can be applicable to everyone because everyone engages in activities. All right, we can mosey on. So what activities are children expected to do in their daily life? So when you look at an average day for a child, quite typically they're playing, they're doing some sort of education, they're eating, and they're engaging in hygiene tasks. So when OTs are looking at the different activities that make up a child's day, we're going to look at what are the anatomical, physiological, or neurological things that each of these domains require. Where might children be struggling, and how can we help? So each domain you're going to find very commonly will require our bodies to be organized to complete an activity. So if we want to pop to the next slide, we can talk about very often what that means. So fine motor, all your small motor movements, particularly with your hands. So things like buttoning, picking up Cheerios to eat, zipping up a zipper, grasping any sort of small item, knobs on a puzzle, things like that. You need those small muscles working to be able to complete those tasks. Gross motor, you think of the obvious ones, running, jumping, climbing, but we also need things like postural control and strength so that we can sit at a table and complete our work. So that's your large muscles working in collaboration to complete a task. And finally, visual motor. So commonly understood as kind of hand-eye coordination. That's your ability to see something and plan a motor response to it. We use these three things constantly throughout our day to complete our activities. And when we struggle with them, we can kind of build some frustration. And that's where OTs like to go in, see what component pieces of an activity are giving our clients difficulty in these realms, and then design our interventions to support them in that. All right, so we have another poll here. So this is a fine motor specific poll, and what is the developmentally appropriate age for your child or any child to use this grasp on a marker? Feel free to take a wild guess.
All right, I'm going to end the poll.
All right, so I'll give you the answer. It's 4 to 5, but I will also state that I feel it's a bit of a trick question for the reason, we can go to the next slide, and you can see here the milestones, and I'll kind of walk you through them. Just give that a moment to pop over. Excellent. So you see that around 3.5, to 5, you get what's called either a static tripod or a dynamic tripod. The difference between the two is it's the same grasp, but with a static tripod, you're going to see more of the movement being generated from the shoulder or the elbow or the wrist. So these kind of big motor movements, whereas your fingers won't really be doing the moving. And as you move into a dynamic tripod, all that movement is going to be generated from the fingers themselves. So looking at a picture, it can be kind of hard to determine, is that a static tripod or a dynamic tripod. Before those emerge, you're going to see palmar supinate. Very often that's just called a fisted grasp, when you get the fist and the scribble. Digital pronate is when they're coming over the top. Very often they extend that pointer finger and they're drawing like this. And then you see the tripod starting to emerge. The reason why OTs care about this is your first 3 fingers here are your precision fingers, and your second 2 are your stabilizers. So as you start to think ahead towards handwriting and things like that, you want to be able to stabilize your hand on a table and let your fingers do that work in writing, or else your whole hand is going to fatigue if you're using these big muscles to do this fine work. Also, you'll see handwriting is really large, and then it gets smaller and smaller as you're able to really hone those muscles. So that's why OTs like to focus on this progression. Quick tips. Using a broken crayon is a really great way to compel your fingers into that tripod grasp, because instead of being able to grasp the whole crayon, when it's broken in half, they have to use those fingers because they can't use the whole crayon anymore. They don't have the surface area. So that can be quite effective. Also, when you have a child use a vertical surface, it brings their wrist up a little bit, and that can promote a more functional grasp over time. So very often, if I have someone who's working on developing their grasp, I start on a chalkboard or a whiteboard. Then I'll go to kind of a slant board with just an angle on a table, and then finally to the table. So if you're finding that your child is having some difficulty with their grasp, those can be like some very quick, easy ways to promote a more tripod grasp. Great.
Maybe there was something to come up in the chat. Ages 3 to 4, the children can trace. I think it was a question about that related to the pencil grasp.
Yeah, that's a great question. So we have what we call kind of a developmental sequence of pre-writing strokes. So these are the marks and shapes that kids can draw before they start working on their letters. So at about 1 to 2, you can start working on a vertical line and a horizontal line. Very often we start with tracing with those. It then moves to a circle, a plus sign, a square. So yes, in short, there are ways in which a 3-year-old could be looking at tracing. You start with those very kind of simple marks like the vertical and the horizontal, and then as they master those, you move into the more complex shapes, curved lines, diagonal lines, triangles, things like that. So at around 3 to 4 years old, you could, developmentally speaking, be looking at something like a triangle. But what's great is we just meet them where they're at, and we know what direction we're going, and we just kind of pace it following their lead. Feeding and eating. I love feeding and eating. I think it's a really fascinating and wonderful area because it's one of the most complicated things that humans do. It takes all of your senses, it takes all of your muscles, both the ones that you can control and the ones that are internal and not under your control. It is social, it is cultural, it is behavioral. When you really think about it, feeding encompasses a lot of what it is to be a person. After 6 months of age, feeding is not a biological imperative anymore, like breathing or staying upright. It is a learned behavior. So by the time they're 6 months old, kids have usually either learned to eat, learned not to eat, or learned to kind of sort of eat. And we see a lot of those kids. And that's really where we kind of do a lot of our intervention. So I'll take you through what OTs typically look at with feeding. One is utensil use, immediately, fine motor. They have to use an appropriate grasp. They have to use their gross motor to complete that motion to their mouths. They have to use visual motor to spear their food or scoop their food. Use utensils. very often if I have a kid who is not interested in utensils at all, it doesn't surprise me because kids do what works, and what's easy is to grab their food and put it in their mouth. And so if I'm introducing this tool that complicates that process, it's not uncommon that they would say, no, thank you, I don't need that. I've got this covered. So I'll very typically start with utensil use based in play. So I'll use Play-Doh for spearing, and I'll use sand or dry rice for scooping, and really target that motor pattern and get them comfortable and successful in completing that motor pattern. And then I'll transition it to food, so they're not experiencing that frustration of, I can't get this thing on my fork and it's taking longer to eat and I don't want anything to do with utensils anymore. So that's been a pretty successful strategy for me when I'm looking at utensil use. Limited diet can be a lot of things. Is there a gastrointestinal component to it? Is there a sensory component to it? Very often, you know, as much as people don't like taste, they don't like texture either. So is there sensory at play? Is there an oral motor deficit? So our oral motor skills are really our ability for our tongue to manipulate food in our mouth and center it and swallow it back. And then also for our lips to contain the food. And if our muscles are weak, that can make it difficult to identify where the food is, properly manipulate it in our mouths, and then swallow it. If there are deficits, then kids might find certain foods or certain textures a little threatening to eat because it's hard to control it in their mouths. So they'll just say no thank you to all chewy foods or things like that. So working on strengthening those muscles to make them more successful. And finally, seating. It's the last thing on this list, but it's actually the first thing OTs look at. Our number one biological imperative, which obviously does not include eating, is actually postural control, which sounds pretty surprising. But when you think about it, if you were to ever, unfortunately, see someone, drop to the ground, you know immediately this is a serious problem. So then it sort of makes sense when you think about it. Yeah, our number one job for our bodies is to stay upright and stay safe and protect our head. So if we're not seated properly, our brain is redirecting energy from what we're doing to staying upright. So we want to put our kids in the best position to succeed, literally, by making sure their feet are flat on the ground. They're sitting comfortably in their chair with their bum back, and they've got back support. And from there, and that the table is an appropriate height. From there, we can look at food. So seating is a very, very critical component to successful eating. We can move to dressing. Again, you're immediately going to see fine motor for zippers and buttons and grasping, different, your pants to pull them up. These are all your fine motor muscles at work. For gross motor, you need to balance to put your pants on. You need that core strength when you're bending over to put on socks, things like that. So I work a lot on just foundational strengthening as well as sequencing. So which come first. And I follow a developmental sequence. So kids usually will start helping with dressing at around 1, pushing their arms through when you give them a shirt, things like that. And on a typical developmental trajectory, they'll be independent around 5 or 6. But there's many steps in between there. Kids typically can undress before they can dress. So I'll look at where they're at in that progression, and then I'll start from where it gets a bit sticky. A quick tip is to have your child use hair scrunchies to pull over their foot when they're first starting to practice socks, because they can see their feet more. It's the same kind of resistance, and it doesn't get stuck on their toes as much, which can be a frustrating component to putting on your socks. All right, next, sensory processing. So OTs do a lot with sensory processing. It is kind of the neurological component of what we do. I just wanted to start by kind of reviewing our major sensory systems, because some are very familiar and some might be less familiar. So we have vision, touch, smell, taste, hearing. Vestibular input, that's our movement system. It's all organized through our inner ear, through the vestibular cochlear nerve. So anytime your head comes out of input midline, you are firing that nerve. So when you're on a roller coaster and you get that wonky feeling, that's your vestibular system at work. And proprioception is our body's awareness in space. So it relies on like stretch and compression to know where you are in your environment. They're really, the sensory neurons for proprioception are very highly clustered in your joints. So it's the reason why I can close my eyes and touch my nose. It's because all the proprioceptors in my elbow is telling me here's where my arm is, until I'm then able to touch my nose and realize, where my hand is. So you use proprioception a lot. It's the reason why you can walk in the dark. It's the reason why you can read something and walk and not bump into every person and every wall you go by. You don't even think about it, but it's working for you. All the same sensory systems. We just work at different thresholds for our ability, our willingness to tolerate them. So some people seek input and some people avoid input. And the reason why this is important is if you have someone who is very visual defensive, they might have a really hard time in grocery stores because of the bright lights, and it's a lot of stuff and it's a lot of different colors and it's very overwhelming, and it might lead to some behaviors or refusal in grocery stores. If you have someone who's auditory defensive, they might not be able to tolerate, unexpected noise, which might lead them to avoid certain situations. If you have a child who's vestibular seeking, they might be climbing and moving constantly, it makes it difficult to keep them safe or bring them to a restaurant. So our sensory systems really do impact a lot of our ability to navigate our environment in a way that isn't overwhelming. So OTs do what's called a sensory diet, and it basically we look at an individual and we see what they're seeking and avoiding is for each of their sensory system, and then we design activities or environments to help them satiate what it is they're seeking or avoiding. So a common one would be if they don't like loud noises, headphones. Another common one for kids who love to run. Okay, every 15 minutes, we're going to get up and we're going to play, a game that involves some sort of running, red light, green light, something like that. And it allows us to sort of better control how they're seeking or avoiding sensory stimuli in order to have a little bit more of a fluid day or an even keel. So I have a graph here for you. I know when I started in ABA, I was a little overwhelmed by this graph. So bear with me, I'll tell you the relevant information. So this is a graph that tracks just the amount of behavior is occurring in a day. This one is the amount of times a client is running away from an adult during a day. So the higher the X, the more frequently they're running away. So you can see this client was having a bit of a hard time staying with their therapist. They were pretty constantly running away, which is obviously a safety concern. So his BA asked me to go in, and I observed him and I asked about his different sensory seeking behaviors. And I designed a sensory diet specific to him. So this is him before, so quite a lot of running around. This line right here represents when we started giving him a sensory diet every 15 minutes. And you can see how dramatically this behavior dropped off to 0 incidents, essentially, of running away. So that's sort of the power of acknowledging these seeking or avoiding behaviors and working with them, because either way, they're going to be seeking or avoiding. If we can identify and accommodate, we get results such as these. So at Bierman, there's 2 major kind of ways you can access OT. Number 1 is direct services. So I would go in and complete a standardized assessment for my client. I would develop goals in collaboration with their parents based on what they're seeing at home and what their needs are at home, what the standardized assessment let me know might be a useful direction to go. And then I do pull out one-on-one sessions every week with that client. The consult model is also an excellent model. I would meet with the behavioral analysts quite frequently to embed OT into a client's day. A good example is something like a sensory diet. I assist with ABA programming, so maybe they're working on fine motor. I'd go in and help with that. And then I overlap in some ABA sessions and kind of problem solve or give a little bit of support. And that way, they're getting OT essentially throughout their whole day. And behavioral analysts are really, really adept and wonderful at incorporating some OT goals into their day. So that's typically how OT gets run at Bierman.
Thanks so much, Maeve.
Thank you.
So now I'm going to talk a little bit about the applied behavior analysis side. So this is just going to be a very brief introduction to behavior analysis. There's a lot that goes into it, and I wish we had enough time to really dive in deep, but let's get started. So the focus of ABA is to observe behavior and find out why a behavior is happening. So hence the title, I behave, you behave, we all behave. Behavior is happening all the time. Anything you do, your child does, your boss does, any of that can be considered behavior. So to get a clear picture of a person's behavior, it's important to label the behavior as objectively and measurably as possible. Behavior can kind of, depending on the observer, look different or sound different. And especially since we're collecting data on behaviors all day long, we want to make sure that we have a really clear picture of what we're looking for. So for example, if I wanted to take data on how many times a person hit a baseball, I would need to define exactly what I was looking for so that anybody observing that behavior would know exactly what I was counting as hitting a baseball. So I would describe or define that behavior as a person's bat making contact with the ball. And it can be an objective or measurable definition can be created for any behavior. So since our goal is to make that behavior clear, it's best to avoid words like good, bad, not listening, temper tantrum, because I'm sure that each of us, if we were told to define that right now, we would all kind of have a different picture of what that meant. So we want to make sure that whatever we're defining as that behavior is something that we can clearly see and clearly measure so that we can take data on that behavior and make sure that we're making progress to either increase or decrease that behavior. So what I would love for you guys to do now in the chat is use the chat to try to define to me a behavior that you would like to see decrease. So this could be a behavior that you're trying to get your child to decrease right now. It could be a behavior that your child has been working on, but just take a moment to go to the chat and just define a specific behavior that you are looking for. And I'm going to start reading some of these as they come in. So throwing objects, stimming behaviors like hand flapping. And I like how you added in that hand flapping aspect, because stimming behavior can be one of those broader terms that encompasses a lot of different things. Hitting self, hitting a parent. So these are all behaviors that are pretty common behaviors that we see in some of the kiddos that we work with. So we're going to talk through why we really focus on those behaviors and how we kind of look at changing those behaviors. Okay, so let's really start to talk about why it is important. So we want to see undesirable behaviors decrease and desirable behaviors increase. And the way that we do that is we try to teach appropriate replacement behaviors. So, and we try to really figure out the function of why that behavior is happening. So here's an example below. So it says, Sammy hits his mom every time he wants a cookie. He is taught to request cookie and get a cookie to replace hitting for access to a cookie. Now his requesting for cookie increases and his hitting decreases. So think back to the behavior that you just provided on the last slide. So the first step in decreasing that behavior is to find an appropriate behavior to replace it. And the way that you're going to do that is to determine what the function is. So it's trying to figure out why your child is doing that thing. So in this example with Sammy, Sammy just wants a cookie. So every time that he wants a cookie, he has been hitting his mom. And in the past, that may have produced the result of him getting the cookie anyway, which is why he was probably engaging in that behavior, because it had given him that outcome before. So in this example as well, his mom taught him to request the cookie. So, depending on how your child requests for things, that could be with a point, with a device, by saying the word cookie. Any of those could be appropriate requests. But by Sammy's mom teaching him to request for the cookie, then Sammy learned to ask for the cookie, and that is when he got access to the cookie. And he stopped getting access to the cookie when the hitting occurred. So ABA can be used for a lot of different things. It can be used to increase many different behaviors. So I want to talk through some of the common behaviors that we target. The first behavior you'll see on the left is communication. So this is obviously a really big one. We want every single person to be able to communicate all of their wants and needs as much as they can. So this can include requesting for the items that they want. It can include communicating by following directions or understanding the directions that you say, labeling different things in the environment, having a conversation, answering basic questions. All of those are in the umbrella of communication. So, as I mentioned before, regardless of what mode of communication your child uses, whether it be sign language, vocal communication, a device, a picture exchange, any of those things, we can teach all of these things across any mode of communication. Another skill that is commonly targeted is play skills. So this includes independent play skills, so playing functionally with an item, being able to play independently and without the attention of other people. It could also include engaging in some pretend play with items like a play kitchen or a tool bench, or pretending to be a doctor. And then this also includes social behaviors as well. So that goes into the next category. They could be playing with peers, with siblings, having conversations with peers or siblings, and then also just listening or observing to the cues of other people in social settings. But it can also work on developing independence in children. So Maeve touched a lot on this when she was talking about fine motor, like being able to dress themselves or undress themselves, being able to use utensils. So that's where we can really work together to build upon those goals that get them to be more independent in their daily lives. We want to make sure that we are setting them up for success in any environment that they're in. So leading into the next point, toilet training, making sure that they can pull up their pants by themselves, pull down their pants, making sure that they know how to wash their hands, that they can use the bathroom. So all of those things are things that can be targeted within ABA and things that we're always trying to work on and move forward with. So similarly, ABA can be used to decrease many different behaviors. So behaviors you may want to decrease could be challenging behaviors, such as the ones you guys mentioned in your examples: throwing, hitting, screaming, crying, self-injury, all of those things you would want to see decrease. It could also be just decreasing the duration in which your child is upset or agitated throughout the day and engaging in those behaviors. But some other behaviors you may want to decrease could be repetitive or stereotypy type behaviors like hand flapping, lining up toys, repeating certain phrases or certain words. All of those could be things you want to see decrease. And also, it could just be the duration of time it's taking them to complete certain tasks. So, from the moment that you place the direction to put on your shoes, how long is it taking them to put on their shoes? Can they understand the direction that you're giving them? Um, are they going straight to their shoes and putting them on, or are they trying to avoid that scenario? Are they, bouncing from toy to toy? Are they trying to run away from you? To try to escape that task. We can help with all of those things by creating small goals and just working up to those larger goals. So really, regardless of what the behavior looks like, your child is trying to communicate something, a want or need that they are having. So that means whether the behavior that they are engaging in is desirable or undesirable, the function of the behavior is more important to look at because that's going to teach us how we can help them the most. So if your child's screaming to get your attention, and every time they scream, you're directing your attention back toward them, whether it be to tell them to be quiet or to give them what they want, um, then it's likely that they'll continue to engage in that screaming behavior because they are achieving the outcome that they're looking for. They are getting your attention by engaging in that behavior. So, to change that, you could stop providing attention for the screaming and try to teach them something more appropriate. If it's attention, for this example, you could teach them to tap you on your shoulder. Let's say if you're on a phone call or you're talking to someone else, you could get them to tap on your shoulder. You could get them to say your name. And you can do all of this by modeling those behaviors to your child. It's going to be hard for them in the beginning to know that that behavior is an option. So it's going to take some teaching in the moment. But if you're consistent about withholding that reinforcement or withholding that attention or whatever they're desiring out of that, out of engaging in that behavior, if you're able to withhold it for those undesirable behaviors and only provide it when they're engaging in the desirable behaviors, then they're going to learn that they are going to get that desired outcome just by engaging in a different, more appropriate behavior. And then, and this is also important, to provide reinforcement for that behavior. So when they are doing really great things and they are engaging in those desirable behaviors, we want to make sure that you're noticing that and you're giving them the things that they want. If they ask for a cookie, maybe not all the time, but they're getting that item that they've asked appropriately for. Or let's say the first time that they spontaneously come up to you and tap you on the shoulder, make sure that you make a big deal out of that or give your attention as soon as you're able to make sure that they're contacting that reinforcement or what they want out of that interaction. So let's take a look at some more examples. So Timmy wants a bead to finish his craft project. He says bead and his mom gives him a bead. In the future, when he wants the bead, he requests the bead. So the behavior that we're looking at here is requesting for the bead, and that would be the desirable behavior. And the reinforcer that he's getting for that is a bead. So he asks for the bead and he gets the bead. The second example is Cameron wants to swing at the park. She cries when told to wait, and her mom puts her on the swing. In the future, she whines and cries when she wants the swing and does not immediately get it. So the behavior in this example we're looking at is the crying or the whining, and the reinforcer is the swing. So you can see in this example here, Cameron got what she wanted out of it. She screamed, then she got the swing right back. So the next time, since this is a learned behavior, she's going to learn that by screaming, maybe she can get what she wants the next time too. So that could be why you're seeing some of those behaviors increase. I would just encourage you to think about the behaviors that your child is engaging in and think about what they are accessing from that exchange, and see if there's anything about your behavior that could change to help them learn a more desirable behavior. Okay, so I'd love to practice. Now that we've briefly talked about the why of behavior, let's look at the different functions that we as behavior analysts look at every day. So we have 4 different functions that we associate with the different behaviors that could happen. The first being access. So that's when a behavior is attempting to get an item, an activity, an environment, a person, something tangible is the reinforcer. So an example of that would be, I want cookie. So you could say, I want cookie and get the cookie. You could exchange a picture of a cookie and get the cookie. Point to the cookie and get the cookie. So all of those things would be trying to access that tangible item of cookie. And that could be the same for any tangible item. The next function of behavior is attention. So we touched on it briefly in the last slide, but this is a behavior occurring to get the attention from someone else. So it doesn't necessarily mean that it has to be positive attention. It could also mean that any type of attention they're seeking from you. So in this example, if this child wanted his brother to look at him, he hits his brother and his brother looks over. But instead, you could say, can you look at me? Or tap them on the shoulder like we talked about too. So it's all about just identifying that that is the function that they're looking for and deciding what a more appropriate behavior would be. Another common function is escape. So this behavior would be occurring to get out of something or to avoid something. So this could be running away from broccoli presentation. So if your child really does not like broccoli, you put some broccoli on their plate and they're out of here. They're running away from it because they don't like it. They're trying to escape it. It could be pushing something away. So maybe you've presented them with their shoes because you're getting ready to leave the house and they're trying to push them away because they don't want to put their shoes on. It could be saying no or engaging in some type of vocal protest to get out of something. So anything that you can identify that they're trying to escape. They could also be trying to escape an environment. So like Maeve touched on, loud noises or overstimulating environments. Let's say a fire alarm went off at the center and they started to engage in a bunch of challenging behaviors. We could teach them to ask for headphones or cover their ears or something that may make that environment more peaceful for them. And then the last function is self-stimulation. So these are behaviors occurring because it is automatically reinforcing. And we would classify behaviors like stemming or stereotypy within this category. So it doesn't necessarily need any social behavior. So it's not anything that you're doing or anything that the environment is doing. It's just automatically reinforced by something internally. So that could be the hand flapping that you see, the repetitive comments or statements, like movie scripting, stuff like that. It could be biting fingernails or chewing on a pen cap, anything like that that doesn't really need the involvement or interaction from anything in the outside environment. It's just more of an internal, they're internally filling that need. But I'm going to pull up another poll. So I would like you to identify what the function of behavior that you had mentioned earlier. So you mentioned a behavior earlier that you would like to see decrease. And as we've been talking about this, I'd like to see if you've been able to identify what function that is serving your child. So I'll give you guys a couple of minutes to think on that. And if you're unsure, that's completely okay. Sometimes And we'll talk about it later too. Sometimes things can serve multiple functions. It can start out as one and end as another, or it could be dually maintained. So if you're unsure, that's okay. Okay, I'm going to go ahead and end the poll. It looks like across the board, they're kind of scattered, which makes sense since a lot of the behaviors were not similar behaviors, and every child has different needs and different desires. So it looks like everybody's are kind of across the board. So we'll continue talking about it, and then we're going to open up to have some questions later. So if you have any specific questions about this later, you can feel free to ask that in the chat. Okay, so as we talked about reinforcement, I want to dive into a couple different types of reinforcement that can be provided. So we're going to talk about positive and negative reinforcement. So positive reinforcement just means they are getting something that they want after that interaction. So here's another example. Lily raises her hand and the teacher calls on her to answer a question. So in this example, Lily raises her hand because she wants to be called on, and she's getting what she wants out of that interaction by raising her hand. In this second example, Carson's brother has his favorite toy. Carson grabs the toy from his brother and runs into the other room. So Carson has clearly learned that just by grabbing what he wants, he's able to get what he wants. So that's a very learned behavior. He's learned that if he just takes it and runs away with it, then maybe he can keep it for longer. So he is provided with that positive reinforcement because he has access to that item. And then the third example, Timmy is in his bedroom playing with his toy cars. Mom comes in and says, "All right, Timmy, time to clean up your toys." And as a result, Timmy begins to whine. Timmy ends up with a few extra minutes to play with his cars. So, maybe in this example, mom had to go deal with his siblings and trying to get them to go clean up. Or maybe mom just didn't want to fight that battle right now, and that's okay. I'm a parent. I get those battles. I, have been in those situations myself, but you can see here in this example that Timmy's whining will probably occur in the future because he was able to avoid that situation of cleaning up. And so it's likely in the future that he will continue to engage in that behavior again to try to access that the next time that he's asked to clean up. Okay, so let's talk about negative reinforcement. And I really want to talk about this because the word negative always kind of gets a bad rep. So that negative does not mean something bad is happening. Negative really means they're just getting out of something unpleasant or aversive. So in this example, Kamal's mom gives him peas for dinner. He begins throwing the peas, and then the mom takes the peas away. So if the throwing occurs, then and the peas get taken away, then he's getting out of that activity of eating the peas. And for the sake of time, I'm going to skip through the second example, but really the key here is that something is taken away after the behavior occurs. So that's the key example of negative reinforcement. So to kind of reiterate those, positive reinforcement is something's being added to the behavior after it occurs, and negative reinforcement is when something is being removed after the behavior occurs. But in everything that we do, we're just trying to create a teachable moment. So since this is just an introductory webinar, it's okay if you're feeling like you might need help to identify these different functions that we've been talking about, or specific replacement behaviors if you're unsure. But we just want to make sure that we're trying to make every moment a teachable moment. And if you are a current client, your behavior analyst will be a really great resource for you and person to ask when it comes to your specific child about specific things that might be catered to them. If you're not a current client and let's say you're on the wait list or you're not even associated with Bierman, you can always reach out to the clinical director of that location, or we have an information email that I'll share with you at the end of this presentation. But in summary, we try and make sure our children get the things that they want for things that we deem socially acceptable. So, because for too long, many of them got what they wanted by engaging in those undesirable behaviors. So, it's our job as caregivers to make sure that socially desirable behavior is easy. So, we want to pick things that are going to be easy enough for them to do. And that they'll actually be able to contact that reinforcement and access the things that they want out of that interaction. And sometimes they may lapse and revert to old ways, and that is not a problem. And it is probably going to happen. All kids are super smart and trying to figure out ways that they can get around what you're trying to ask them to do. But it's really important to stay as consistent as possible. And just attend to whatever they're doing and why they're doing it, and try to modify your interactions to help make it a teachable moment. And again, the replacement behavior should be easy enough to where they can do it and access what they want. Okay, so we're going to take one last poll. Okay. So here it says, Jimmy wants a cookie because he is reaching for it, but you just got home from the store and have to put the milk in the refrigerator. Jimmy can vocally say that he wants a cookie, but he starts to cry and flops on the ground. So what can you do? Okay, for the sake of time, I'm going to end the poll here, but I'm going to share your results because you guys are rock stars. You're going to wait for him to calm down and then have him say that he wants a cookie. That's perfect, you guys. Great job. Okay. So Maeve, I know we have a few different slides to cover. How are you feeling about all of these? Do you just want to go to questions? What do you think?
It might be more useful for people to ask questions, and then if they have questions about how we collaborate, we could just address those more specifically.
Okay, I'm gonna go forward to these last few. Really, if you want to talk about your takeaways, and then I'll do mine, and then we can open it up to questions.
Great. So these key takeaways for OT that I'd love you to walk away from is OT uses neurology and biomechanics and determines how an individual's neurology and biomechanics impacts their function and their ability to engage in their everyday activities, what we call their everyday occupations. Once we identify those, we target individual and environmental modifications. So an example would be strengthening up those hand muscles for fine motor, while also giving them that broken crayon to help them with their grasp. So that's an individual and an environmental modification we can use to target, something like a grasp. We design our therapy to increase engagement. We want that motivation. We want that participation. That's really important for us. And then we use milestones to kind of measure our progress, see where our clients are, and see where we're going based on developmental milestones. So what I would love for you to take away is that OT is all about function and all about independence and engagement. And we're always focused on real life practical applications to what it is we're practicing. I might have a child, popping bubbles one day, and but what I'm actually working on is handwriting, because I need them to isolate that finger to work on that grasp. So there's a lot of different ways to get there. But at the end of the day, it's always a functional application of our therapy.
Awesome. And the key ABA takeaways for you guys are to just work on defining the target behavior, what it is that you're looking for, because that's going to allow you to be able to know what you're going to increase or decrease. Also understanding the why. Why is the behavior happening? Because then we're going to be able to identify a replacement behavior to teach your child to make sure that we are able to get them to do something more desirable for the same outcome. And then we want to reinforce all that appropriate behavior so that they know they're doing a great job and that they continue to engage in those desirable behaviors. We also want to withhold reinforcement for the challenging behavior and just be able to identify those things that we do have a role in reinforcing and just try to make those modifications to help make it a teachable moment. And just do your best to stay consistent because that consistency is going to achieve the results that that we're looking for in decreasing those behaviors. So frequently asked questions really quickly. Will this webinar be recorded? The answer is yes. It will be recorded and you will be sent a link in a few days to this webinar, but you can also access it on our Bierman YouTube channel. And you can also access any of the previous webinars that we've recorded there as well. So just take a look. It's going to be a great resource if you have any additional questions or want some specific information. And then here are some of our future webinars. So this month we have a Let's Play Developing Play Skills for your child with autism. We also have another introductory ABA and speech services on May 5th. And then a discussion on change, helping your child navigate changes that arise due to holidays, vacations, and routines. So you can visit our Bierman ABA Caregiver Training page to find out any of our upcoming webinars as well. So I know we're a minute over, but if you'd like to ask any questions to either of us about any of the content that we reviewed with you guys today, feel free to enter any of that information into the chat. We'll hang out for a few more minutes to answer any questions you might have. But yeah, if you guys don't have any questions, then we really appreciate your participation and your attendance, and we hope you learned something. Maeve, I'm definitely going to be adopting your broken crayon tip. I love that idea.
Yeah, it can be, it's amazingly effective.
Yeah, I mean, you just take the thought right out of it. There's just only one way you can do it.
Yeah, and then what's also nice about it is you're not over prompting them, constantly manipulating their hands and making the whole thing sort of frustrating, and you're over involving yourself. It's just a way to kind of be able to step back and let them do that work themselves, which is really helpful.
Yeah, that's an awesome tip.
I do have a client that he can write all of his letters, and he's really, really good and enjoy. But he is he's got such a persistent fisted grasp, and it's really remarkable. And so for him, I got triangle markers, and those also work really well because they kind of really, encourage your fingers to go into that 1, 2, 3 pattern. So
Are
that's
they the ones that have like the different colors on either the triangle markers? Am I?
mine. Yeah, we do have those, but the ones
Okay.
I have, they're, your typical one color per marker, but the actual shape of the marker itself is a triangle. So
Okay.
it's less comfortable to hold in their hand, because those edges just are kind of irksome. And so it's useful for kind of that kind of persistent fisted grasp to use those markers as well. So I'd recommend those guys too.
That's awesome. Well, thank you for the tips.
Of course.
Well, it's not looking like we have any questions. So if you want to feel free to log off, you can.
All
But
right.
thank you. This
Thank
is
you.